San Diego 6 News in the Morning. Your station for balanced news.
Good morning and welcome to San Diego 6 in the Morning. I'm Courtney Dwyer.
And I'm Alex Michelson. It is Sunday, September 13th. This morning we're talking about something that affects so many men out there, whether it's you, your dad, your friend, your brother, whatever. Chances are you know someone who's either had prostate cancer or is at risk for it. As our friend Mark Bailey recently showed, if you catch it early, you can have your life saved, as luckily he did. But how do you do so? A doctor from Alvarado Hospital will join us with some important advice. That's coming up. Prostate cancer is the #1 cancer in men. It's a subject that can be difficult to talk about, but if you don't, it can be deadly. Our friend San Diego 6 in the Morning anchor Mark Bailey just recently had prostate cancer surgery, but because he caught it early, he should make a complete recovery. Now, with more on what you or your dad, brother, husband, friend, etc. need to know to stay healthy is Dr. Reza Shirazi from Alvarado Hospital. Doctor, thanks so much for being here. We appreciate it. The #1 cancer in men, this is a huge issue.
Correct. As you know, September is Prostate Cancer Awareness Month. It affects 1 out of 6 men in their lifetime. It's like many other things in life, not 100% consensus, but majority of the people agree that screening leads to early diagnosis, and it should help because it gives you more treatment options. And
this is kind of the male version of breast cancer, if you will. It's kind of a similar type of thing, and early detection is such an important thing here, as we saw with Mark. What's the detection process? Because when people think about it, they think about a certain area and they start to get uncomfortable and they don't want to go through with the process. What is the process, first of all?
Well, actually, since the advent of a test, PSA, prostate-specific antigen, it's been much easier to detect it. Before the advent of that test, men would go for many years and they would come with bony metastatic disease where we couldn't really offer them cure. But because of this blood test, it gives us a red flag that we should really look into prostate cancer in these patients. And many people have come to become detected and get treatments. The other part of the examination or screening is digital rectal examination. Unfortunately, the way we have to diagnose or examine the patient is through the rectum. It's a little uncomfortable for the doctor and the patient, but it's the best way to assess if there is any abnormality in the prostate.
And it's something that could make a huge difference in your life. I mean, go through with it. And for people over 50, right?
Absolutely. American Cancer Society recommends screening on men that are expected to live beyond 10 years from where they are. Screening with a digital rectal examination and PSA once a year. If there is family history of prostate cancer, that age should be pushed back to about 45, or if you had a really early, like a brother or father, first-degree relative at age 40, maybe at age 40 or sooner, you should get screened.
And go in and get that test every single year for the process. And kind of what are the big misconceptions about prostate cancer out there?
Well, I guess in terms of the treatment, it's a very slow-growing disease. People are going to do well for many years. So if they have active heart attacks and diseases that is going to do in their life, maybe it is not the wisest choice for them to get screened, and they should really talk about this with their primary care physicians. But there are many options of treatment out there, including surgery and non-invasive ways of approaching it.
And is there something that you can see in your life that you notice, I'm feeling really uncomfortable with this, you know, maybe I've got it, or is it kind of silent?
Unfortunately, it's one of those silent diseases that it really doesn't have an alarm that comes about, and that's the reason for late diagnosis before the advent of this PSA and the digital rectal examination.
And what would your advice be to maybe women out there who've got their husband or their boyfriend or their brother or whatever, and they're uncomfortable with the concept of going in for screening? How do you prompt them to go through with this?
It's a very good point. Many fairs that we've usually had a mammogram booth right next to having a prostate screening booth.
Oh, really?
Women are really the biggest advocates of bringing their husbands in and their loved ones, their father, their relatives in. So just annual screening after age of 50, if they're expected to live beyond 10 years, is really recommended.
And any like expected treatments that work better than others?
There are many options. All cancers don't come in the same degree. There are different forms of it and different severity. There's many options. It's sort of like geometry. I usually say that there's more ways than reaching the same answer. There is surgical options, there is radiation treatment options, and various options like high-frequency ultrasound and upcoming things. They have become more non-invasive. Minimally invasive is the key, and with new technologies out there, we can really do these procedures outpatient-wise without any bleeding, infection, things like cyberknife radiosurgery.
And great to hear. And then you can be back at work not too far
Absolutely.
after that and be back healthy and living great as Mark is right now. We're all thankful for that, and thank you for coming in and talking about this important issue. We appreciate it.
Thank you.
And for more information on prostate cancer, you can go to our website, which is san diego6.com. Just click on Hot Topics.